Hey everyone. So I wanted to do a 1-week post-surgery video just to give you a feel for how my chest is recovering. I also wanted to talk a little bit about Dr. Garamoni and the services that he provides, and what else? I don't know, we'll see what I can cram into this 10-minute video. So here's what my chest is looking like right now. I have a little bit of wrinkling around the nipples on my chest just because I continue to wear a band-aid around each of the nipple grafts. My steri-strips are still quite intact. There's a couple of sections where I've cut the steri-strip off because it's come off and it starts catching on my shirt, so I just trim it back whenever a large piece comes up. Under my arms I've got a little bit of puckering back where the drains were. That side's not so bad, this side's worse. I don't know how well you can see that. Got a little bit of puckering. This is the drain that gave me the most problems while I was recovering down in Florida, so it doesn't surprise me that that one's the puffiest and the one with the most puckers in it. But I've seen other guys with those too, and I know that once the swelling goes down that those are just going to go ahead and get sucked in. But as far as a profile goes, I'm quite happy with my chest. Now, I don't have as much swelling as I probably would have. Dr. Garamoni said I shouldn't be taking any kind of aspirin or Motrin, ibuprofen, for at least another week or so. But I've had to go into my doctor's on Tuesday because I had a couple of really swollen veins in my right leg. I messed up my right leg really bad when I was 15. I was hit by a car, and I've got some serious varicose veins in that leg, and a couple of them started getting really hard and painful. So I showed them to Dr. Garamoni, and he told me just to go see my primary care physician when I got back into town, and I did that. And he was concerned about it turning into an infection. I had just finished up with my antibiotics from the surgery, but he was concerned that those veins could become infected. So he actually wrote me off of work for the rest of the week and has had me up pretty much on bed rest. I've been sitting with my leg propped up and with a heating pad and taking ibuprofen. He has me taking ibuprofen this week and just doing very little so that I don't cause any bleeding from surgery in any of the areas that I had surgery. And then next week when I go back to work, I'll stop taking those, and hopefully the veins will have shrunk and I won't have a problem with them anymore. And for the most part, they're a lot smaller and a lot less sore than they were on Tuesday when I saw him. So because I've been taking the Motrin or the ibuprofen for that, a lot of my swelling has gone down, and so the only places I really am still puffy are right here in the middle, and then right under my arms. I can't, man, this is like backwards. Right there, I'm still really sore and puffy under there. It feels really bruised under there still. And this side's about the same. For the most part, I've got all the nerves sensation coming back right through here, and actually my skin is hypersensitive. I go out into the cold and it really throws me off because when I get chills, it really tingles intensely through here. It's almost painful. Let's see, I've even got sensation coming back in underneath as well. About the only places where I'm still numb are right here right under my arms. I'm still quite numb right in here. But this whole area was numb right after surgery, and when he took off the bandages for the first time, all of this skin was numb. And so I'm surprised how fast the nerve regeneration has gone, because I've got sensation back and it's almost hypersensitive. Even to touch it like this it bothers me. in the light it's hard to see. My right pec, I've discovered after after surgery, I've discovered that I was able to build up my right pec really well, and my left pec isn't as developed as I thought it was, and I thought I was building them up the same, but I'm right-handed, so obviously I do more with the right side because my right pec is a lot bigger than my left one, turns out. So anyway, that's my chest. One thing that I really like about Dr. Garamoni is that he is up to date on F to M legalities and procedures. He offers you a letter after your surgery, and he'll give you as many notarized copies as you want or need. And if you need some at in a future date and don't have any copies left, all you have to do is contact him, and he'll send out a letter. But I wanted to read you the letter that he gave me, just to give you an idea of what the letter entails and what it covers. It says, Affidavit of Dr. Charles Garamoni. I am a physician whose office is located at 126, the address. He says, I am a man, I can't read. I am a surgeon duly licensed to practice in the state of Florida. My medical license number is. This letter is in regard to my patient Seth, whose date of birth is. He gives my date of birth. Psychological and medical testing has been carried out to determine this patient's true gender. In the case of Seth, this was determined to be male. Seth has been diagnosed with gender identity disorder, also known as transsexualism, and has undergone psychological treatment. Seth has been referred for and undergone surgical procedures performed by me to irreversibly correct his anatomy and appearance. Seth has been treated in accordance with the accepted medical protocol for the treatment of gender identity disorder and has completed sex reassignment in accordance with appropriate medical procedures. On 2/27/2009, I performed sex reassignment surgery on Seth. From a medical perspective, Seth is now male, and the gender marker on all of Seth's identity documents should now be changed to acknowledge this medical fact. This should qualify Seth to be legally considered male within the guidelines of the particular jurisdiction in which this individual seeks to legally change his gender status. I declare under penalty of perjury, under the laws of the state of Florida, that the foregoing is true and correct. So that's a really sweet letter. I showed it to my doctor and to my therapist, and they both made copies of it because they really liked the wording that he used on it. And I was able to take that letter Monday and go to the Secretary of State here in Michigan and get my driver's license changed and my Social Security card changed to reflect a male gender marker. So I'll be getting that in the mail here. At least my driver's license should be coming here in the mail in the next couple of days, and I'm really excited about that. So now the only trick that I have left to do is get the gender marker changed on my birth certificate in Utah. So I'm still doing research to see whether I can do that while being here in Michigan, or if I actually have to travel to Utah to do that. So anyway, that's about all I have for today. Thank you to everyone who's been giving me so many compliments on my surgery. I really appreciate your words of encouragement. And I just want to give a shout out to Cole and to Mark. They both had their surgeries done the same day I did, so all three of us got to meet with Dr. Garamoni and sit in the waiting room and just chat over how excited and pleased and grateful we were to be able to be there. Hope they're doing well. Hope their recovery's going well too. Take care, and I will talk with you guys all later. Bye.